Hi, I'm Dr. Emily McGowan from the Division of Asthma, Allergy, and Clinical Immunology at the University of Virginia in Charlottesville. Today, I am pleased to demonstrate how to use the I-SEE application to easily assess disease severity in patients with EoE using a real-world case example. The American Gastroenterological Association's Index of Severity in Eosinophilic Esophagitis, or I-SEE app, was developed to give clinicians an easy way to evaluate the severity of EoE in routine practice. I-SEE allocates point values to key disease features, including symptoms and complications, inflammatory features from endoscopy and histology, and fibrostenotic features from endoscopy and histology. From these points, the app calculates a score, categorizing disease state as mild, moderate, or severe. In this example case, an 11-year-old girl with a history of asthma and atopic dermatitis presents with a parent to the pediatric gastroenterologist. She's been having difficulty swallowing solids and some liquids multiple times a day. She also reports experiencing heartburn. As a result, her parent helps convey that she does not eat much and avoids foods with certain textures. The patient's endoscopy shows diffuse edema and mild strictures, and her biopsy reveals 32 eosinophils per high-powered field. Let's see what this case looks like when entered into the I-SEE app. First, we select the age group of our 11-year-old patient. Disease features may be weighted differently depending on this metric. The next screen is symptoms, where we add the reported difficulty swallowing, compensatory behavior of avoiding foods, and heartburn, all of which happen multiple times per day. This is not a patient-reported outcome, but rather the clinician's conclusion regarding symptom frequency and can reflect any symptom related to EoE. As you enter each patient detail, you'll see their I-SEE score change in the colored circle in the top right of the screen. You can tap the More Info button at the base of each step screen for a description of what that disease feature may entail. Next, we can enter any patient complications, such as impaction or hospitalization. Features like esophageal perforation or malnutrition, which is commonly seen in younger patients, garner 15 points and automatically categorize a patient's disease as severe. This patient does not have any of the listed features, so we select none. Note that there is also an option to select when this data may not be available. On the endoscopy screen, we can note this patient's diffuse edema. And mild strictures were observed, and the scope fit was snug but did not prevent the scope from passing. This patient's histology showed us an eosinophil count of 32 eosinophils per high-powered field, but no additional histologic features were observed. The app has calculated this patient's I-SEE score, classifying her EoE as moderate. Once you've calculated an I-SEE severity score, you can tap the Resources button at the bottom of the final screen for an explanation of how the score was calculated. Although the I-SEE score is not yet validated to support specific treatment decisions, you may use the score to help your patients understand their disease progress or as an indicator that new treatment options can be discussed. For a patient with moderate disease, treatment options are growing. Conversations about patient preferences might include strategies such as diet therapy, proton pump inhibitors, topical steroids, or a biologic. More therapeutic options are becoming approved, such as budesonide oral suspension and dupilumab, either of which could be discussed with a patient with moderate EoE. This makes monitoring disease activity and severity essential to helping our patients understand their disease and when it might be time to make a change. I want to thank the AGA for sponsoring the development of the I-SEE tool. We hope that this education helps clinicians to more easily and proactively evaluate disease severity in patients with EoE.